radius, and lastly we go to the height. Okay, so we are going to go through those 7 points, and the most important point will be the last one. This one will be important for you, which are the clinical points, clinical relation. What is the clinical importance of this bone? The common site for fracture, the common structures spotting below or above or related to it. Okay. So we go through the upper limb bone, then this one might take around 1 hour, then we maybe take a break, then we go through the front one. Okay. So first, for the first bone we have the clavicle. Sometimes we call the collarbone. Okay. So the site of this bone, this one will be located here, in front of the chest and the lower part of the neck. Okay. So this one we call the clavicle. The type of this bone will be long bone. Okay. Long bone. Why long bone? Because any long bone will be having 2 ends and shaft. The definition of long bone, the bone will be having 2 ends and shaft. Okay. And for the clavicle parts and features, you can see here, the clavicle will be having 2 ends. This end you can see a little bit quadrangular, and this end is a little bit flat. Then for the shaft, you can see it's concave and convex and concave. Okay. So the medial 2/3 they are going to be convex, and the lateral 1/3 are going to be concave. So if you try to feel, you will be feeling the medial 2/3. The lateral 1/3 you can feel or you cannot, but the most prominent will be the medial 2/3, which will be convex anteriorly. And the medial 2/3 will be having 4 surfaces: superior surface, anterior, inferior, and then posterior surfaces. While the lateral 1/3 will be having superior, inferior surfaces, but 2 borders, anterior and posterior border. Okay, so those are the parts and the features. If you look here, you will find the superior surface will be very smooth, but the inferior surface, you can see so many impressions, not to be rough. Okay, there are here part we call the trapezoid line, and also the conoid tubercle. Those are important for attachment of ligaments. The important parts will be the side determination. How could we know that this one is right from left clavicle? Okay, so there are 3 points to know right from left. 3 points. The first point, will be determining which is the medial end, which is the lateral end. The medial end will be the quadrangular part. The lateral end will be the flat. This is the first point. The second point will be the shaft. So the anterior 2/3 must be convex anteriorly. Okay, and the last point are going to be the surfaces. The superior surface must be smooth, and the inferior surface must be rough. So this one is right clavicle, right clavicle. Okay.
3 points.
So 3 points to identify right from left clavicle. Okay. We are going to go through back again. So this one, when you speak about the attachment for the clavicle, so we have 4 muscles attached to the medial 2/3 here. You can know it by just thinking or imagining. So the superior surface will be giving attachment to the sternocleidomastoid muscle here. And for the anterior surface here will be giving to pectoralis major muscle. And then for the posterior surface, for the stylohyoid muscle. And the inferior surface, they are going to the subclavius muscle. So 4 muscles attached to the medial 2/3. The lateral 1/3, there are only 2 muscles. 1 muscle attached anterior here will be the deltoid muscle. So the deltoid comes from here and go down to cover the shoulder. And from the posterior 1/3 here will be the trapezius muscle. Okay.
Scaling? Scaling, sorry.
Scaling attached to the first cervical. Right? So those are the muscle attachment, important muscle attachment. Then we have the articulations. So this one will be forming along with the sternum here. So it will be forming the sternoclavicular joint. Sternoclavicular joint between the sternum and the clavicle. The type of the joint will be saddle joint. Saddle joint. And we have also the lateral end will be articulating with the acromion of the scapula. Will be articulating with the acromion of the scapula. and this one will be forming the acromioclavicular, will be forming the acromioclavicular joint, because this one is not the right. Okay, so there will be the acromioclavicular joint. So there are two joints here. Basically, the clavicle will be transferring the weight of the upper limb to the trunk, the body trunk. Okay. So the clinical importance of the clavicle will be the most common. This one will consider one of the most common fracture bone in the body, and the common site for fracture will be here, the site between the medial two-thirds and the lateral one-third, because this will be the site for the curving here, and any curvature of the bone means weak point. So always will be fracture here. So the clavicle when fractured, what happened that the medial two-thirds will be pushed, elevate upward, okay, and the lower and the lateral one-third will be pushed downward. Okay, this one will be pushed upward or drawn upward by the sternoclavicular muscle, and this one by the weight of the shoulder will be pulled down. So what happened that it will be overlapping like this. You can see in the X-ray, it overlap like this, and there will be distortion of the shape of the shoulder joint. So the clavicle has very important points they usually tend to ask about. First, the clavicle will be the first bone to ossify in our body, and usually the bone will be ossifying by one primary ossification center and many other secondary ossification centers. But this one will be the only one ossifying by two primary ossification centers. And also it will be the only long bone which will be ossifying in membrane. We have two types of ossification. We have the intramembrane specification and the cartilaginous ossification. So the membranous ossification usually will be for the flat bone like the skull. However, this one is a long bone supposed to be having a cartilaginous ossification, but this one will be doing membranous. So it will be the first bone to ossify. It will be the only long bone which will be ossifying by two primary centers, and it will be the only bone which will be ossifying in membrane. And finally, it will be the only long bone which will be lying horizontally. All the long bones in our body will be lying vertically. This one will be the only one which will lie horizontally. Okay? This is all what you need to know. There are important parts also. Passage of the subclavian vessels and the brachial plexus will be below the clavicle. Which parts of the brachial plexus will be the cores of the brachial plexus? So brachial plexus have 5 parts. We have the roots, trunks, cords, divisions, cords, and then we have the branches, right? So the divisions will be passing below the clavicle. So fractured clavicle may injure the branches, and also the subclavian vein and artery also may injure by fractured clavicle, may lead to hemorrhage. Okay. So again, for the clavicle, so we go point by point. So the site, the lower part of the neck, and also in front of the chest and the lower part of the neck. For the type, will be long bone. Okay. For the anatomical parts and features, so it has two ends: medial end, lateral end. Medial end quadrangular, lateral end flat. And the shaft we divide into medial two-thirds and lateral one-third. The medial two-thirds convex anteriorly, lateral one-third will be convex posteriorly. For the surfaces, we have for the medial two-thirds 4 surfaces, and for the lateral one-third we have superior inferior surface, anterior and posterior border. How to know right from left? 3 points. First, for the end, this quadrangular end, medial end, this one will be medially. And then for the shaft, the medial two-thirds will be convex anteriorly, and finally for the superior surface we're going to be very smooth. So this one will be right clavicle. For the attachment, we said for the medial two-thirds here, the measure here.
Superior
Here is sternocleidomastoid. Here would be one of the muscles of the infrahyoid, is stylohyoid muscle, and then we have the
Here we have
subclavius muscle. Here, deltoid here, trapezius. Okay. So this one is one of the most common bone to fracture. The common site fracture between the medial two-thirds and lateral one-third. What are the structures which are susceptible to injury?
course of the brachial plexus, subclavian artery.
Yes, the divisions of the brachial plexus and also the subclavian vein and artery. Okay. Okay. So